I wonder, you talked about this a little bit, but I wonder if you could talk about more how you found those correct treatments um, and were able to get on them after being misdiagnosed and mistreated.
So, like I said, I felt like an experiment, a guinea pig all my life, because I actually also have eczema. And it's funny enough, eczema at its worst, it can also be considered, it is considered a disability. And if my PTSD exacerbates my eczema, it can be head to toe and you can't function. It's really painful. Um, so because of my eczema, I have five of the seven types. Um, since I was a girl, I've been doing medical studies at NHMC, not NHMC, at National Institute of Health, some Mayo Clinic studies. So I've been in, that's how I was saying, when I do research, I read medical journals because I've been in all these studies. I've had to sign these contracts of what I'm doing in these studies and then what the findings are. They share that with me, and so I've been more exposed to reading these all my life. But it was through that. Anytime that I needed help, especially if I didn't have insurance, I would just look online for, let's say, clinicaltrials.gov, or I would just Google, clinical trials, medical trials. I would say maybe some of them might not be safe. I would go for the big Mayo Clinic, National Institute of Health. There's others, but I would do research on who's conducting the study. So you don't want to be injected or given some weird thing that's going to, stay with you forever and be bad for you. But I was doing, skin studies, eye studies. And then if I was depressed, I would do a depression study. And for this, I found a study for PTSD, and I didn't have health insurance. And they were conducting it at UCLA. I got really, really lucky, and I did my treatment there. It took about a year, I want to say. And then the next time I relapsed, it was several years later. And then eventually I got on health insurance. So ever since then, it's been, making sure I have the right people, and it's still an ongoing battle because not every therapist is going to be right. There's going to be things that happen that their views aren't going to align with yours. And it sucks getting a new therapist because you have to rehash everything, and that's re-traumatizing. But you want a therapist that understands you, respects you, doesn't blame you, because none of this is a person's fault. This is all natural. It happens. We have to manage it. We have to basically deal with it and do the best that we can with it. But no therapist should ever blame their patient for anything that's happened to them. That's a no-no. But so clinical trials is how I figured it out, and I was able to, because otherwise I would have been lost.